All right, we are now live at Cinnamon Girl Clinic with Jody Stoski.
Hello.
And Chris.
Hi.
So we're just gonna wait a little bit for people to join, and why don't we bring you up to speed on what we're doing. So we already have one areola done, or almost done, and we're just getting started on the second. Jody, what step are you on?
So we've already completed what I like to say is defining the nipple. On this areola, Chris has basically everything more intact than on the other side. So creating symmetry is where we want to go today, and just shape. Chris was after something that looked really similar to what he already had. So that's been our goal, knowing that when I do see him on the second procedure, we can definitely add more, especially with shape. So it's important to not go, too big, too round, so that Chris has the ability to come back and tell me all the things that he would like.
All right, so we're getting a close-up here of what Jody is doing, and we would love to invite anyone to ask any questions about this procedure, about areola tattoos in general, to leave us a question, and Jody will answer it on this live.
So Chris, tell our lovely viewers about what part of your transition you're comfortable sharing, how we got to this stage, surgeries, whatever you feel that you want to talk about today.
I am an open book, so any questions people have, I'm willingly able to answer them.
So how long ago was your top surgery?
I'd say it's been over 2 years, heading on to 3, not quite. I think it was July 2019. Oftentimes when you get top surgery, if you're interested in getting it, there is a likelihood that not the areola, but the nipple can fall off or just not take to the body and kind of reject. So you can see one's intact, and then the other, for whatever reason, rejected, so we're just trying to make it look better.
So this one here that I'm showing you is the one that's intact. You can see it's very much 3D. And you might be deceived over here that it looks 3D, but that's just thanks to the tattoo. When we look over here, it's actually flat. So that is the magic that Jody is able to offer. So Jody, we have a few questions. One is which machine are you using?
So I am obsessed with wireless. It is a rotary machine. So this would be a machine that you would see body tattooers using traditionally. And moving on to PMU and paramedical, this is also my machine of choice. The cartridges are universal. So when we do talk about needle configurations and sizes and gauges, we're all talking the same language. So that I like the power of this machine. I like how it tattoos. And this one specifically is called an Omnia. And you can get that at Hive Beauty. I do have a discount code. If this is a machine that you're interested in, use Jody15 at checkout and you'll get 15% off anything paramedical. I tell you that because it's nice to kind of throw a little bit of a discount towards people who might either not have this machine or are looking to get into paramedical and maybe don't have all the supplies that they might need.
Amazing. So from Hive Beauty, the Omnia machine, use Jody15 and you'll get 15% off, and that's any products on Hive Beauty. So our next question is, how is doing a male areola different than a female areola?
So a male areola in general basically has less detail. We tend to not see a lot of the ducts. We don't see as much of size typically, and we're looking to essentially make things look more masculine than more feminine, so almost a little bit less detail in this style of areola is what we're going for, and we'll build the detail up as we go and just keep things pretty basic. I find I love doing these types of areolas. I love putting the detail in, but I also love just creating the 3D, creating something that looks more feminine versus masculine and vice versa.
Awesome. So basically the male areola and the female areola, Jody follows the same process, but the male areola just requires less detail in it. And on that note, Mandy's wondering, how many colors do you use for areola tattooing? So I'm going to show you guys these ink trays, and we can see that Jody is using 4 colors, and one of those colors is white, which is going to be the highlight to add those extra details at the end. Jody, do you want to tell us about these colors a little bit and why you use 4?
Yeah, definitely. So in anything 3-dimensional, we tend to need a highlight, a low light, and a mid-tone. So when I pick colors, I typically want to get that variety so that I can create the contrast. When you sometimes get colors that are too close together, you really lose that sense of those defining points, and then looking from afar, it doesn't look as realistic as it could. So we match on the skin, we match on paper towels to find the proper color. With Chris, he wanted, again, that same color. So I'm really going on what Chris had and really going for the duplication on this side and just filling in a little bit on this side because the color already exists in the areola and a little bit in the nipple. So you can see that I've actually defined the bottom part of the nipple just to create some shading. This will heal really soft, and then I've gone on the other side and done a little bit more detail just because there was not any.
Awesome. So those darker colors are to create that detail and define that nipple. And then there's the mid-tone areola color. And then of course we have some highlight colors as well.
Yeah.
We have a few more questions here. When do you use pointillism versus circular shading?
So it's a bit of a mixed bag depending on the canvas I'm working on. So right now, to fill in these outer edges of Chris's areola, I've actually been using circular, kind of tight, slow motions. When I come back, I'm going to show you guys just how I will stipple in that scar because it is less likely to hold the color, especially just doing a circular motion. So I am going to just do a quick symmetry check on Chris, and then we'll keep going. Okay.
So,
Come on up, Chris.
Jody, we can see that Chris also has some scarring
Yes.
from this surgery, separate from the areola. Do you ever camouflage those scars?
These scars here,
And do you do that at the same appointment, a separate appointment? How do you handle those?
you know, it depends on if my client feels self-conscious about this. It's something I often talk about in the consultation. These are actually really amazing scars. Chris, first off, what are your thoughts on, just to share with the viewers?
Which part?
These scars underneath here.
Oh, they're so tiny. I was so worried that they were going to be a lot bigger.
Yeah.
But the incisions were actually pretty small, so it's faded beautifully in my opinion.
It has. So I just find if it's not on the top of people's radar, you know, it's not something that we need to go into. I do like to offer the fact that I could make them better, and if I were to do it, it would be fine to do that in this procedure. However, doing the areola first, so that this has not been opened up and then my areola color is getting potentially wiped into that area. So all darker things first, all lighter things last is sort of my MO.
Awesome. Well, there you have it. Those scars can be camouflage. It's totally up to the client. Typically a separate procedure. And Bo Beauty is wondering, Jody, do you do a scar camouflage course online? And I know the answer to this is absolutely yes. Jody, can you tell us a little bit about your online scar camouflage course?
Yeah, absolutely. So to start, I'm always a big advocate of fundamentals when it comes to paramedical tattooing, which a lot of people don't quite have, as this is very much in its infancy, this whole type of tattooing. So learning how to camouflage scars, learning the different types of scars, skin grafts, burns, hypertrophic scars, keloid scars. There is a vast amount of knowledge that I think is super important for you to have before often even moving into areolas. So yes, that is available online. I do go over all of it. It is very comprehensive. There's a lot of quizzes that I think are important to know that you understand that knowledge before moving forward, plus certificates at the end. And we do have a private Facebook group to help you down the road with questions and concerns.
Awesome. So if you are interested in camouflaging scars, Jody's course covers it all, the fundamentals, the procedures, and it's available online at jodystoski.com.
And a lot of my students, actually, just to add to that, have said that in the past, if they had taken paramedical tattooing in person, they found that this was more informative than what they've learned online, which is so nice to hear that, you know, we are checking the boxes for our students and they do leave confident and comfortable to start executing procedures on their clients. In fact, I talked with one of my students yesterday and she says she had a wait list of 20 people already waiting for paramedical services. So I think a lot of people, when you don't know, you don't know. You may think that you don't have a need for it in your area, when actually you do, because people don't know you exist. They don't often know that these procedures even exist. So it's something to definitely think about when it comes to differentiating yourself, not just from your competition, but really just elevating your services and including an underserved market like the transgender community. Chris, weigh in on that for me. Like, what do you think about being able to come to a business that, well, we are trans friendly, that's part of a registry for the transgender community to know that they can feel comfortable and confident in us. We understand not only the language, but, you know, what could be things that make you feel unsafe here. So what is it to come to a business and know that it is trans friendly and that, you know, these services do exist?
It leaves me ecstatic, not only for myself, for others, because I know a lot of people are self-conscious of even just their gender identity and how they want people to see them. So I think this is a huge deal that these type of services are even offered, because a lot of people feel stuck in their own bodies or self-conscious about it, even transgender people, and they go through so many procedures just to come out as who they are, but they don't always go well. So it's nice to know that there's options to feel even more confident as who you are.
And Chris mentioned to me earlier that, you know, being misgendered is really emotional and can be sad, can leave you angry, and that the goal here is to, you know, match the outsides and the way you present to others to the way you feel inside. And really, this areola tattoo for you is going to help do that, and we're just so excited to offer it. We're so happy you're willing to share with us and with others this procedure.
Well, I appreciate that this is even happening, honestly. Like, it's so important to transgender people to be seen as exactly how they feel, and sometimes it's very difficult to get that out, you know? Like, if the way you see yourself in the mirror is not exactly what other people see, it's almost like perception. So we know how we feel inside, and we can almost see it on the outside, but not everybody can. So being able to go out, I know a lot of transgender people, they're either very open to being publicly transgender, but other people, they want to look more cisgender so they can blend into society, so things as mistaking someone's gender doesn't occur, because it can really put people down when they work hard to present a certain way and it still isn't shown to other people where they can catch on.
So Jody, where are we at now on this areola?
We're actually getting really close to wrapping it up. You can see I still have a little bit of work to do in these scars, and that's normal. We do need extra, I like to do pointillism and stippling in those areas to get better retention. So I'm gonna just work on that. We'll do some symmetry checks on Chris, and we are just about done.
And when we are done, we have a question about aftercare. Do you use Tegaderm bandages?
I sure do. I can almost always use a Tegaderm bandage in this type of procedure, and the reason for that is it's nice and flat. And then Chris doesn't need to do anything. It stays in a really clean environment, and the tattoo is healed within about a week. So those bandages typically do last that whole time, and if they do come off prematurely, it is fine as well. It usually just hangs in there, no problem.
So thank you to everyone who's continuing to join. Just to recap, this is a 3D areola tattoo procedure for gender affirmation after a top surgery.
So this is something as a PMU that you can be offering. Not only procedures like this that I'm doing on Chris, but also self-harm, different scars that people are self-conscious about that leaves them feeling like they couldn't wear shorts because they have a scar on their leg, or they couldn't wear a shirt that was short sleeve because they have self-harm scars. And it is such a rewarding part of my business, and I do love sharing this with others so that not only they can help their clients heal with tattoos, but just experience how incredible this is to share and to give to other people that are in need of this.
And we have someone who just joined partway through, and I mean, we're partway through the procedure as well. They're wondering, how long does this procedure normally take from start to finish?
You know, it kind of depends on what I'm doing and how much work I have to do, and the scar tissue that runs through the area. So honestly, it can take me anywhere from an hour, depending if it's a unilateral versus a bilateral, to 2 hours, usually tops. And I would say most of the time, it's the patient does not feel much. There's a little bit of sensitivity sometimes in a couple areas, but typically not unbearable by any stretch, and we can use some topical anesthetic if needed.
And Chris, I'm looking at you. You, at the start, were like, what? I don't feel anything. And then had a few moments. Can you tell us about how it feels?
Yeah, so for some areas, there were times where I was even asked, like, how does it feel? I was like, you're doing it? Like, I didn't even know or realize. But then there's moments where you can definitely feel it, but I wouldn't say it gets any higher than a 4 out of 10 when it comes to pain. But that's with my pain tolerance, but I wouldn't say I have a high pain tolerance, so that's good.
So Jody, tell us a little bit about when you do have clients who are feeling the pain, and what numbing do you choose and when do you put it on?
So I never start with a topical numbing before I get started. The only time I'll start to use numbing is once the procedure is moving and I've basically broken the skin. And I use Bactine for this, to be honest. It's basic, it's easy. You can bump it up as long as there is no epinephrine in it. We do not want constriction in this area. Typically just a lidocaine is enough.
And right now we can see a number of Jody's certificates on the back wall there. Jody, I believe you've done over 10,000 paramedical tattoo cases.
I sure have. It's, it's a combination of both paramedical and PMU, although a lot of times it runs into both. For example, if you're doing brows, you may have scarring in the brows, so knowing how to work in that area, and that would, obviously be considered a PMU, but then having the knowledge of how to treat that and successfully get the tattoo to stay in. Okay, I'm gonna get Chris cleaned up and I wanna have a peek at how everything is looking. All right. So once I get pretty close to done, I like Chris to sit up. I can get a good idea of symmetry and any other adjustments as the nipple and the areola start to constrict as we work. So we do lose, it may not look perfect to start with. That's only just because of how the tissue starts to contract throughout the procedure. So you always follow your guides. That's why it's so important to map so you do know exactly where you're going. I use a surgical pen to keep myself on track. And then at the end of the day, I was saying to Chris too, it's like visually, that's what's most important, that we feel like it looks how we want it to. Am I right, Chris, or am I right?
You're right.
Okay. So I feel like we have a decent amount of clean so that we can get a good idea. I'm gonna have you just sit up right towards the camera and I'm gonna meet you over there and just have a peek. So nice and relaxed for me, perfect. So you can see this side is constricting a little bit more just because it was the last one we worked on, but I do think I'm still gonna add just a smidge on this side here and then I think we're gonna be done. So come on back down and have a lay down.
All right.
And we just got a great question asking, is this permanent? How many times does a patient need to come back for a touch-up?
So typically, yes, this is permanent. And I usually see people twice. That tends to be enough to complete this and get it looking exactly how I want. However, I always keep my doors open for my client if they feel that there's something else I can work on, especially even with scars and scar retention here.
And for students who are just starting out, I know that you always preach to be conservative because you do always have that touch-up appointment to have them come back, put more detail in, make any improvements. So always go conservatively on that first appointment.
Absolutely. And especially, once you get that constriction going on, it can be a little bit difficult to make sure you've got everything looking exactly how you want it to.
And so how long between the first and the touch-up appointment?
I usually give it 6 weeks. And if for some reason that wasn't enough healing, which honestly I couldn't say when that would happen, you're certainly open. I'm even to leave it like 3 months is fine.
So we have another question. When you're just starting out, what would you recommend charging?
That's a great question. I think there are certainly some different avenues to take. I always recommend once you're starting out to build your portfolio and offer the services for free. How you want to figure out pricing is to look around in your area to get a gauge on what people are charging. If that even exists in your neighborhood, I see people charging anywhere from just $300 up to over $1,000. So it depends. Like I know in New York there are some places that it's $1,500. So I'm not saying that's what you should be charging, and there are people who do these procedures at no charge, which I also think is great. And even in your business, if obviously, we need to pay bills and make our money, but perhaps things like doing special events where you do discounted areolas, or even a day where, you know, people who can't afford it can get in and, you know, have it either at no charge or maybe just a really nice discounted rate.
Right. And so when you're starting off, that's a good opportunity to maybe do it for free. And as you get more skilled, really just be competitive with the other providers in your area, and see what they're charging and kind of go from there.
Agreed. Yeah, totally. And as I'm finishing off, I'm really just working in the last little bit of scar tissue. As I was mentioning before, it tends to be the most resistant to hold the tattoo. So you will find it can look a little bit darker just when you're fresh right after just finishing up.
And what we're seeing right now versus how it's actually going to heal and look in about 3 weeks' time, what is the difference?
Well, first off, we've got swelling and that constriction that I was talking about. So all of that goes away, and mostly the redness. You know, I think it's a little scary, just like in any type of PMU. It's a little terrifying because it's dark, it's red, it can be swollen. I do find this tissue, especially on a nipple sparing type reconstruction, like what Chris had, that's super, super common. So you can see I've really focused more on the outer edge because that's where we were missing a lot of color. When Chris comes back, I will probably do a little bit of blending, but I don't want to create too much darkness in this areola so that I don't end up having to go back and forth to get the balance. It's more, like I said, about being conservative. Okay. So.
And for everyone who joined us a little bit later, we just want to show you again how this nipple here, there actually was a nipple mound. It was more 3D.
So.
And then on this side here, we actually did not have the nipple. So you can see it's just totally flat. And when you're like, wait, there is a nipple there, that's because Jody has created one with the 3D areola technique. So we have another question. How deep into the skin is your needle compared to a standard PMU like brows?
So it depends on, good question, by the way, I get that all the time. I usually have my needles out probably about 3 millimeters, and when I'm in scar tissue, sometimes further out, because the scar tissue is thicker, it's denser, it needs more pressure to get through, and typically the best way to get in there is to stipple or to use pointillism. Just going around in circles, you won't find that you get as much retention. All right, Chris, we are on the home stretch. You can have a layback again. We are just a few details short.
And I think you guys might have seen we have a camera over here, and we have David in the corner, and I'm Haley, and we're filming this procedure to actually put on YouTube as well, so stay tuned for that. But we wanted to give you this sneak peek, and thank you for joining us live. We have another question. Thank you, Caitlin. So how many different needle types are you actually using throughout the areola procedure?
So today on Chris, I pulled out 3 needles. Have only used 2. And I do in my courses go over what are the proper configurations, why I use them, what I'm doing with them. And I think that helps students get a better understanding of what they should be using, but then just watching it in real life and seeing, oh, okay, she's using a 7 or a 3 or a 9, and that was the result she got. So it's kind of taking the guesswork out of these types of.
And in your areola course, both the full areola course as well as just the gender affirmation course, you actually show real procedures and cases and tell us exactly which needle cartridges you're using and everything in those courses.
Absolutely. And again, it is a variable, so I want to throw that out there to students, but visually learning as artists, I think, is just more our speed. So it's definitely, I think, nice to understand what I'm using and, you know, the needles and speeds and depths that might help you along as well, even though you're probably tweaking them a bit for your own.
And we do have another question, a great question. Do you always work standing up?
On areolas, I do. I just feel like I want to be over top of my client and like right in their face, right, Chris? Invading their personal space. But, you know, the one thing I like to do is just have them sit up so I can check symmetry, even though I know that constriction is there. And then, I don't know, I find it easier on my back, although I end up contorting myself sometimes as well. But
And I will show you guys when Jody's not working standing up. She has this awesome chair. It actually has an aerobics ball on it, wheels, so she scoots around on that when she's not standing up. And Jody, I believe on your website, you actually have an entire list of your favorite supplies, links to where they can buy them and everything.
Absolutely. And one other hack, Haley, that you might want to show our viewers is their actual rollerblade wheels on the bottom. So if you want to show people that, you buy them on Amazon after, and it allows you to just roll around super freely. And it's also a back saver. I find from, you know, years and years of tattooing, my back was starting to get really, really affected, really sore, and that has saved me for sure. So the chair is available on Amazon. I have a link to it on my site, and the wheels, same idea. All right, Chris, let's have you sit up and let's have a peek. For this one, I'm going to have you come on, stand up, and let's look in the mirror together and see what adjustments, if any, we need to make.
All right.
Woo!
Whoa. That's insane.
How does that make you feel now that you see that?
I'm literally thinking which one is the one that actually has the nipple.
I know, right?
Yeah.
Now this one's a little more red because I did more work in it. So there's all those little inconsistencies that you'll see right now. As they're healing, it will come together even better as that all just absorbs and heals and your body has time to kind of digest and absorb.
Yeah, oh my gosh. It's amazing.
Are you happy, Chris?
Yeah.
Chris, is there anything now that you and I are looking at it in the mirror that you feel either stands out to you or that I can add?
Not really. Honestly, you did an amazing job. You just made them look more natural too.
And don't you feel like now the shape, even though you were like, oh, it's a bit oval, I love it on you.
Yeah, like I literally used to hate it, but maybe it's because it seemed uneven. Now that you've actually touched up on it, it looks a lot more natural.
So one of the things that I like to do is kind of give it a pull. As you're looking at it, you're like, oh, okay, that's what it's going to look like when the area is not sort of kind of all scooching itself in there.
Yeah.
All right. So, Chris, let's take some after photos like we had talked about.
Yep,
same spot. And then afterwards, I'm going to put the Tegaderm bandages on. We'll show the viewers how we do that, why we use them, what they look like, and you are all finished.
Wow, that's crazy.
Yes. Okay, well, come on back over.
Amazing. So everybody, I'm just going to answer the last questions. Yes, Mandy, we will post the before and afters. Derma Med Spa, yes, the link to the scrubs Jody wears, these cute figs, are on her website. And for the pre-numbing, no, Jody doesn't pre-numb. She might numb while she's going. And so because we are now going to take our after photos and wrap up this procedure, we are going to be logging off. Thank you so much to everybody who joined us. Those are the Tegaderm bandages that will be part of the aftercare. And I'm just going to log off now.
Bye, everybody.